Hello everyone. I am going to start a session of sarcodes and no-sodes discussion in a constitutional prescribing in bedside clinic, which I learned from the decks of Dr. L.M. Khan sir, and having a great result and experience of these drugs. The drugs which I am going to discuss a remedy uh, in my session like Ambragracia, Anthracinum, Basilinum testium, Carcinosin, Lysine, Osteoarthritis nosode and Insulinum. A constitutional prescribing of these remedy. I am giving a short clinical experience of a remedy like Carcinosin, which we observe in a patient, especially whatever may be the disease name. If the symptom of a carcinosin, which we prefer and confidently prescribe, especially the background and the history of the family prone to cancerous disease, and the patient is preferred to lying on knee elbow position. There are many drugs like medorinum, calcarea phos, lycopodium, sepia, acetic acid, tuberculinum, phosphorus, and carcinosin, as well as importance like medorinum as knee elbow position. And the mental symptom of the carcinosin is very fastidious in the nature, and have a strong desire for the dark chocolate. I am saying not only chocolate, dark chocolate. And one strong symptom of the mind, which we saw in the tuberculinum personality, whimsical. And a very strong symptom of an asthmatic complaint, the patient having persistent whooping cough with the past history of the pneumonia, and the patient get better lying on knee elbow position, and the mental level of the patient are fastidious in the nature, and the desire of the patient dark chocolate, extreme desire, and enjoying the thunderstorm and the especially lightning. As the physical appearance which I heard and saw from my father clinic in a patient, cafe au lait, physical personality of the patient and the color of the cafe au lait discoloration. Like if you saw a milk and you put coffee on the milk, the color which comes shows the cafe au lait color, which saw in a carcinosin personality. And there are many symptoms of a carcinosin which I am going to discuss in my session. A very wonderful remedy and very fruitful result. I saw my father, he prescribed even a suspected cancerous disease, but it's also mentioned in Allen's keynote, should never be prescribed carcinosin if you are suspected of carcinoma in a patient, but I saw my father prescribe and get a great result. If the patient have a personality of a carcinosin, if suspected or not suspected, we should prescribe carcinosin. And I'm going to discuss in a very uh, broad discussion on the carcinosin like remedy in my session. Thank you everyone.